Hello, my name is Andrew Petrosoniak, and today I'll be talking about a new way forward, using simulation to inform the design and training of a massive hemorrhage protocol. I do have a disclosure to mention. I am a co-founder of a design and simulation firm that uses simulation to design new clinical infrastructure and processes, but the topics discussed during today's talk won't be reflected and have no relation to our company. We're going to talk about two main objectives, I think, today. We're going to first discuss broadly simulation for systems testing, and then more specifically, we're going to look at the application of simulation for massive hemorrhage protocols and how it can be used in a tangible and practical way. But before we begin, I want to discuss a hypothetical case, one that I think that resonates with most people. We'll call it Anywhere General Hospital. And at this hospital, there's been recent incident reports that have been flagged and quality improvement initiatives that are being investigated, and there's been definitely adverse events that have been related to getting blood to bleeding patients, in that there's been issues with identification and there's been delays in getting the blood. Basically a set of adverse events that have been identified, and within and among the clinicians in the blood bank, at the bedside, and among the hospital leadership, they all know there's some issues, but they haven't been able to really readily identify the problem. And it's on the background of them trying to figure out a way to implement an MHP. And so they have these set of issues broadly. They know there's a general problem, but they haven't been able to identify accurately what it is and subsequently implement changes that are effective. And when we talk about a massive hemorrhage protocol, what we're talking about is a complex system. And what it allows for is efficient delivery of blood products to patients who are massively bleeding. And while there certainly are standards to follow, at different institutions, we can allow for some customization. We can allow for local considerations. But yet it's when we start to deviate from these standards, which are entirely acceptable, we do run risks of inconsistency, and that's where adverse events can occur. And so I want to draw the analogy to that we have this wonderful new tool, MHP, and we've become accustomed to how we can deliver blood and blood products and deliver care to bleeding patients, with us accepting and having a good understanding of how that can be done, with the idea that we still need to make some local customization, and we might need to tweak this process along the way. And the analogy is the same way that we understand how cars should be built and driven and how safe they are, but yet we still crash test new models. And so that should really be no different than new protocols or an MHP protocol at new institutions, that it needs to be customized and ensure that it works as intended. And I think this question here it should resonate with many of us, that have you ever planned something in your mind that turns out very differently in reality? And it's this dichotomy or discrepancy between work as imagined and work as done that so frequently we get surprised about when we put a new process into place. So that many of us think, when we sit around a boardroom table and we imagine how an MHP is going to get implemented, it's exactly as we see here, this nice, steady, straight line towards the flag. And yet the work as done, it becomes very difficult and very challenging, because there's all of these other system interactions that we didn't anticipate. And what we really want to do is have the work as imagined, when overlaid with the work as done, be as close to those two should line up as close as possible. And how can we do that? Well, We can use simulation, and simulation really should be a core element of MHP development, design, and implementation. And for those that are unfamiliar, simulation, this is a quote from David Gaba, who's one of the pioneers of simulation from about 15 years ago. Simulation is a technique, not a technology, to replace or amplify real experiences with guided experiences. And so for many of us, we're familiar in healthcare with the use of simulation to train teams, to get them better, because we borrowed this from the aviation industry, where we would use flight simulators to train pilots to get them better. But more recently, we've seen simulation become allow us to evaluate and improve systems. So not only we can continue to improve and evaluate teams and individuals, but now things can get much more interesting when we can actually evaluate and improve systems and processes. And so what I'm talking about here is we've shifted away from exclusively evaluating whether an individual can perform a procedure very well, where they can learn. So that's, in those moments, the individual or the team is the unit of analysis. But when we start to alter our view about how we can use simulation, we can start to think about it as using a system or a process as the unit of analysis. And that's the case for MHP. So we might imagine that we can, by using simulation, we can start to gather data that is much more powerful than anecdote to inform change. And so while anecdotes, people saying, oh, there was a problem with the MHP, that might be the initial, that might spur some reason for investigation, but it's the data that's going to be really useful that we can gather through simulation to really inform and support the change that occurs. And you can imagine, we can't predict when an MHP occurs. It's very difficult. They happen, even in the busiest trauma centers, at most once a day, but likely once a week. And so to be able to readily capture that event is almost impossible. And we might imagine we could video record it, but then we run into challenges with patient privacy. But we can plan these using simulation and video record, and then actually observe what is actually happening any day of the week we wish. And it's at that time that once we have this better data, once we have objective findings, we can then start to improve our decisions. And by knowing and understanding truly what is the problem with the MHP, or understanding the implementation challenges, we can then start to make more informed and more accurate and design more accurate solutions. And finally, last but not least, by doing so, we can engage teams in not only the outcome, but the process. And it's that engagement that helps support a culture of learning. And so we can start with tabletop exercises through simulation. And so we may decide, well, we have this new protocol, we would like to see how it fits in our own institution. Let's walk through this in an informed way and ask appropriate and key questions. And when done properly with simulation experts, you can gather a lot of information about how blood might move through the hospital from the blood bank to the clinical space, and then how coolers can return. And we can troubleshoot very quickly and efficiently the potential challenges that, if not tested, would rely on a patient adverse event to trigger an investigation. And then as we start to refine our processes, we can actually move into the clinical environment. And you can see here an image of the nurse hanging blood here in an MHP. And this is a simulated event, and you can see how where the level 1 transfuser will be positioned and how the team will interact with that. And we can get very granular with our understanding of how the team and the individuals interact with the system. And so what do we know about this is that we know that this results in substantial increases in MHP adherence when we use simulation to inform an MHP implementation. So that more likely team members are going to follow what is required within these standardized protocols. We know that when we ask people afterwards, after they've gone through simulations, that their confidence and the teamwork performance metrics increase. And that's all well and great, but what does it mean for the patient? Well, actually, we've shown recently that by using simulation to identify challenges or issues in the MHP delivery, by then modifying it and improving it all through the support of simulation, we can actually decrease time to blood delivery to actual patients. And it's at that time that we're starting to see meaningful patient-oriented outcomes. So I want to dig in a little bit more specifically into the 4 areas that simulation can help with this process. And so we can expose blind spots using simulation in an MHP, and I'm going to speak more specifically about this in a moment. We can trial new ideas. We can then support team training, and ultimately this results in improved patient outcomes. And so when we talk about exposing blind spots, it's so frequent that we actually don't really understand what the problem is in a protocol when it's implemented. We go to M&M rounds, which is the traditional method, and we rely on people's recall, or we rely on the clinical records to try and decipher what happened. But in reality, when we use simulation, we can actually just recreate the event. People will behave in the same way. We can have observers there, we can video record it, and we can get direct feedback from people immediately afterwards to understand, why was it that you didn't check the blood at the bedside? Why didn't you identify the patient prior to administering the blood? Or why did the porter take a very roundabout way of getting blood to and from the patient? All things that, without asking and observing in a objective way, we wouldn't know. And then we can come up with new ideas. Maybe we want to trial a new way of activating our MHP. Well, why expose a patient to a potential flawed system when we can expose only a mannequin to that with no harm to anyone? And then if there's a problem with it, we can make rapid changes to the system. And then before it gets deployed, ensure that it's tested readily. And simulation allows that to happen because we can perform work in the actual clinical environment. And as we have developed and refined our system and our protocol, we can now move into the team training space. And we can train people not on a flawed system, but on a refined system. And the same occurs with these Formula One team pit crews. You can imagine that when they do their team training, they're not working with equipment that doesn't work or in a space that doesn't work. This has been refined over time. And once it's been perfected, then they train in that environment. And they can improve their performance that much more. And finally, what does this result in? Well, by doing so in a systematic way, using simulation to recreate events, understand problems, and then design solutions that are meaningful, we can actually start to make tangible improvements to the patient outcome. And that might be reducing adverse events, ensuring that the right blood gets to the right patient, ensuring that the ratios of within an MHP are administered in a proper way, reducing time to blood delivery. All of the key metrics that we are interested in can be positively impacted by using simulation. And so I want to show a video here of the simulation that occurs within the clinical environment. And so what we're watching here is a simulation of an MHP. It looks identical to what we would see in real life, except we've been able to schedule this. We've been able to gather a team, and now we're able to have observers and other clinicians observe for
I'm
particular
glad to see you.
elements of
Beautiful.
how the
Okay, guys.
MHP gets implemented. And what you can see here is the blood is being brought in.
So let's get the blood running
We
in
have the
level
cooler
1
there,
infusion, please.
and we can observe how what documentation gets brought. We can observe then how the nurse checks the blood, and we can see if there's any challenges they experience and how they use the space and where they do the blood checks. And all of this can be planned when we do a simulation, rather than hoping and relying on people's recall of stressful events. And so it's this degree of precision that allows us to make in more informed decisions regarding improvements of MHPs. And what you can see is that we identified that probably should be doing our patient ID at the bedside, and this is readily identified using a simulation approach with video. And so I want to go back to Anywhere General Hospital. And I'm going to now introduce the team there to using a simulation-based approach to MHP implementation and training. And they've decided that to adopt using simulation as they identify the challenges that they've experienced and how they are going to implement their MHP. And so rather than relying on the more traditional approaches, they're taking that new way forward. They're using it to help design, test, and improve their performance. And so we begin that incomplete understanding of what problems exist in the clinical realm. By using multimodal simulation, we can actually bring those problems to the forefront and accurately identify them. And once they're identified, then the solutions directly come from there, and they engage the end user. And and then we can do objective evaluations without actually harming the patients. So we can run simulations of these new these new proposed solutions. And the team at Anywhere General Hospital is now developing solutions that are customized to their own institution. And then finally, they're able to augment and support their team training strategy by running through scenarios regularly with their team after they've made meaningful changes. And now they have improved outcomes of team training. And what does this all result in? Well, this actually improves their patient outcomes who are massively bleeding in the hospital and who need a massive hemorrhage protocol activation. And so they've mitigated many of the risks. They do so intelligently with data, and it results in meaningful outcomes to the patients. And they've developed a culture there now where the team is readily engaged in the process, and they regularly test their MHP using simulation. And then as they identify additional issues, they can make proper and more informed decisions. And with that, I'll conclude. Thank you very much.